Hello, my name is Dr. Gallione. I'm a physical therapist at AquaCare Physical Therapy. And today, I'm going to be quickly talking to you guys about shoulder pain and one very effective technique that you can do at home or at work on the job to fix it. Okay, so shoulder pain. Shoulder pain can be caused by many, many different reasons. The most likely reason is mechanical dysfunction. And a mechanical dysfunction means an alteration in the way your bones and your muscles and your ligaments and your skin and your whole body works. And when it's altered, when there's something thrown in there, throws a wrench in the works, you get pain. Pain, you get inflammation, you get swelling, things you don't want, and things you probably have since you're watching this video. So, I'm going to show you how poor posture directly affects your shoulder pain and how correcting poor posture can improve and possibly eliminate all shoulder pain, preventing unneeded injections, preventing possible surgery, preventing unnecessary medical costs. And I'm going to show you a technique that you can do at your house to correct it. So, I'm going to demonstrate poor posture, and actually, Kirsten is going to show you poor posture because what she's been doing sitting here typing, and you're wondering why she's sitting here typing while there's a physical therapist giving you directions. What she's doing is this poor posture. This is what most of America does, most of the world does. You sit, you're typing, you're on your cell phone, you're doing paperwork in this slumped posture, just like she's showing. And what that's doing chronically over hours and hours and hours, day after day after day, is it's shortening your pectoralis muscles and tendons, and it's lengthening and weakening the muscles in your back. And what that does, that's a mechanical dysfunction. That's a muscular and anatomical imbalance in your body, which is going to give you pain. And you say, well, how does posture have to do with my shoulder pain? I clicked on this link for shoulder pain, and I'll tell you, shoulder pain, your shoulder is a ball and a socket joint, okay? And when you are protracted or your shoulders are slumped forward in poor posture, it hits. Every single time you try and elevate your arm or bring your arm up, it hits, it rubs, it erodes. That gives you inflammation. And inflammation gives you pain, that's swelling. Kind of like if you sprain your ankle, you get swelling. Well, you can't really see the swelling in your shoulder, but you can certainly feel it. So you go and you get an injection. And what does the injection do? It decreases the swelling. Great. Your pain goes down temporarily, but what you haven't done is corrected the problem. You've just corrected the symptom. So eventually the shot's going to wear off, the swelling is going to come back, and you're going to have pain. So what I'm going to show you is how to get rid of the actual problem. So, Kirsten, yes, like she just demonstrated, correct posture. So what she did is she sat up straight, okay? And by sitting up straight, you're allowing some stretching to happen in the pectoralis muscles, and you're allowing the contraction or the strengthening in the back, which leads me right into the technique. And this is the technique that I want you guys to do at home, at work, that can correct the shoulder pain and the dysfunction, the mechanical dysfunction in your body. There's two levels. I'll show you the first level, Kirsten. So what I want you to do is I want you to put your back to the camera for me. Okay, I want you to hold your arms here. Pretend there's a tennis ball here. I want you to squeeze back. Good. You see these muscles here contracting, strengthening. She's holding this contraction. And hold that for me, please. And what she did here is lengthening. She's lengthening the pectoralis muscles. And what that's doing is that's changing your body back to how it wants to be. It's correcting the mechanical dysfunction. That's the first.
How long do I have to hold this position for?
Oh, thank you for asking, Kirsten. Hold this for 5 seconds. Hold it for 5 seconds, then relax. Do that 10 times in a row. Total's about 50 seconds. Do that 3 times a day, maybe breakfast, lunch, and dinner, or when you have a break at work. That's less than 3 minutes of exercising and stretching a day. You can significantly change your posture and your shoulder pain. Okay, level 2. Level 2 is where she takes her hands and she crosses them like this, okay? And she pulls down and extends. This is more aggressive. This is also very effective, possibly more effective than the first one, but everyone can't get here on the first try. So what she's doing is aggressively contracting these muscles in her back. And if you go around to the front, she's aggressively stretching her pectoralis muscles, which is aggressively getting after that mechanical dysfunction, which is going to decrease her shoulder pain. And you say, well, how does just correcting posture actually help the shoulder pain? And like I was showing you earlier, you have that constant hitting when you're forward. Well, when you come back, it now allows your shoulder to go all the way up. And if you don't believe me, you're sitting at home, try it. I want you to bring your shoulders forward and show me how far you can bring that arm up And you can't. You cannot bring it up far. Roll your shoulders back, and you'll see that your arm comes all the way up. So, hold for 5 seconds, do it 10 times in a row. Do that 3 times a day. And you can eliminate shoulder pain, you can increase your functioning, you can prevent unnecessary medical costs, surgeries, inflammation, shots, which no one likes. And you can do it all yourself, at home or on the job. Thank you so much for watching.
What if that doesn't help though? What do I do?
What if it doesn't? Great question. If after a few weeks it doesn't help, you need to consult a physical therapist or you need to consult your family practitioner. Get some professional help and they can decrease the pain if that mechanical dysfunction was not the problem. Thank you guys for watching and click the like if you enjoyed it.